Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan. Now, here is your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is restorative dentistry. And joining me in the studio is Dr. Lee Sheldon and Dr. Matthew Sheldon of Solid Bite Dental Implants. Welcome, Dr. Lee and Dr. Matthew.
Thank you, Joe.
It's nice to have a father-son team.
I love it.
I can see the brilliance of the education of the father and the son. You're still smiling.
Yes, I am.
And you're able to laugh about it, too.
Yes, I am. I enjoy it.
And you still work together.
That's right.
That's good. That's good.
Yeah.
But today, I do want to try and stick to a script. As much as I enjoy all the things we talk about when we talk about dentistry, the shows we've done together over the years on dentistry tend to make the science of dentistry a little more, I think, interesting.
Good.
For too long, we have looked at dentistry as a must or a last-ditch effort to save our teeth or not do something we don't want to have done or pull our teeth.
Right.
We have sort of changed that line of thinking with the new information about implants, veneers, whitening of the teeth, people wanting to smile more and having teeth that can project a winning smile.
That's right.
My first question was to you, Matthew.
Okay.
I said, let's talk about fillings first, because that's a thing that most people have done, I think, still, is teeth filled. Is that correct?
Yeah, it is. It's still common, and a filling is needed mainly when you have decay on a tooth. We see that in the mouth clinically, or we can see it on a radiograph, on an x-ray. And when the decay is deep enough where it forms a cavity, which is the hole, then we have to fill it in with a restorative material. The older method on the back teeth was amalgam, that silver filling. These days, technology's improved so much where we do white fillings all over the mouth.
Do a what kind?
White fillings, tooth-colored fillings, yeah.
What? It's not an amalgam?
No, it's not. It's called a composite restoration. Looks good, it fits good, and patients are happier, and they're supposed to last a little bit longer.
Is that when you come out with a little sample thing and you put next to the tooth and to compare the
That's
color?
right.
That's it.
That's right. These days, aesthetics are important. We pick shades, and we have all the colors of the rainbow, so we can match exactly the same color as the patient's natural teeth.
Years ago, it was a Good Friday. It was during Lent, and then we had the services on it when they had the washing of the feet ceremony, and this Marine colonel was selected along with me to be one of the patients that had their feet worked. And this Marine colonel tried to get me to paint my toenail red. I refused to do it. Have you ever thought about coloring somebody's filling?
No, but in my residency, we do get odd requests. In my residency, one of the dentists is a big Ohio State fan.
Okay.
So he had on the outside of his crown a little Buckeye tattooed, engraved on his crown. So every time he smiled big, he could see a little Buckeye in the corner. So we do get odd requests sometimes like that. Just like
I never thought about that. A personalized tattooed tooth.
Exactly.
But how have fillings changed over the years? You mentioned putting amalgams in the back. But how about for front teeth? What do we do now?
That's one of the most heavily researched things is these dental materials. They're constantly evolving, generations and generations of evolution of composite and white fillings. And these days, we have good materials that bond to the tooth a lot better than they used to and last longer.
If a person, you've got all kinds of models here. Let's say if a person had their teeth, for any number of reasons, their teeth had darkened. Do you have processes now that can whiten those teeth, or would you put a veneer on that tooth? What would you do?
We can go both ways on that. Patients generally, they'll whiten first if they don't like the color of their teeth. They'll whiten their teeth. We give them a few weeks to whiten, and that's about as bright as their teeth will get. If they're still not satisfied, then there are things called veneers, which are like a fake fingernail on your nail there, and it's tiny. And we cement that, we bond that onto the teeth. It's for patients that don't like the shape of their teeth, if they've got minor spaces, minor crowding, the color. And this is, and it's not invasive. You can see how thin it is. Sometimes we do little or no preparation of the natural
You can actually
tooth.
glue that thing on?
Correct.
Let's say if a person had a separation between these two big teeth.
Yeah.
If you had like a line there.
Yeah.
Can you disguise that with that type of veneer?
Often we do close the gap with these, and we have firsthand experience next to us.
Yeah, if you take a look at the earlier shows, the first few shows that we did,
Yes.
and you will notice that I had spaces between my teeth in those shows. Notice I have no spaces between my teeth now.
Let's see. I can't see. Did you work on his teeth?
I wasn't with him yet, no.
Who did it?
Dr. Jennifer Chase. And she
You ain't let your son do it?
He wasn't around yet. He was barely around. So, and so I have 8 veneers on my teeth. The same thing that Matthew was showing. He was holding between his fingers. I had veneers placed on my teeth, and so my front 8 teeth now are all veneers.
Did it to 8 teeth?
Yeah.
You generally do it as big as you smile. So you want to, and people smile their front 8 to 10 teeth. So,
But they're individual ones so that you can still floss between.
That's
correct.
right.
Yeah.
Because the last thing you want to do is give a person a reason to not floss.
Yeah, that's right.
I remember one day I called you and I said, something's happening to my teeth. I don't know if you remember. And I was flossing. Evidently, I had pulled some of the plaque or the calculus off the back of a tooth.
Yeah.
I thought I'd broken part of my tooth.
That's right.
off.
I remember that. Yeah.
Remember that?
Yeah.
And you said, no, Joe, you just need to do that more to get that off of there.
Yeah.
So, the subject of dentistry can be made as light or heavy as you want to make it. But I think more people in our viewing audiences need to understand that more things can be done, certainly at a lesser cost today than could be done 10, 15, 20 years ago. We don't have to live with dentures that slip and slide that are uncomfortable.
Right.
There's a very simple way to fix a sliding denture. What is that?
Yeah, and this is something exciting. This is what we do a lot in our office is we get the patients that have full upper and lower dentures. They can't taste their food. They can't taste the temperatures of their food. Their dentures are wobbling around. And the solution for that is to help those dentures out with dental implants where they can either stay fixed in place or utilizing dental implants, which are little posts in your jawbone that will snap into the denture. So you've got a solid seat on your denture so it's not wobbling anymore.
But by putting that pin in there, you can still remove the denture, correct?
Correct. Yeah, they're both removable and fixed options for dental implants. And the way I was describing the snap type denture, the patient can take in and out.
I think more people would be surprised if they perceive that they have a dental problem, that you go into a specialist like the two of you and say, here's what I think is a problem. Is there a simple way to fix it? And many times there probably is a simple way to fix it.
Well, the option you were talking, that Matthew was talking about before, the patient can walk in with a wobbly denture and walk out with a denture that snaps into place all on the same day. In other words, we can do the surgery, place the implants, put a reline, a soft rubber reline into the existing denture, and it'll snap over those implants the first day.
Okay, but most people, when you have a denture put in, you have to use
Adhesive,
adhesive to keep it.
particularly on the lower.
Okay, and if you put that coating or whatever you call it on the bottom of the denture and there's snap-on fitting, they don't have to. Do they still have to use that other stuff?
No, it's being snapped. It snaps over the dentures. You're no longer trying to get it to stick to the tissues. Now it's snapping over a pin or over a little bit over. Well, it's actually like the head of a pin. So it fits over a ball-shaped attachment that's right above the gum, and so it snaps into that. You don't need the adhesive anymore. It stays in place.
Wow. So that's a great advance.
Yeah.
Yeah. Are any of these things here crowns?
Yes. Oh, we have lots of crowns here.
How much? Many people, you've talked about putting a veneer on your teeth.
Yeah.
But the purpose of a veneer is quite different than the purpose of a crown.
You're right, because a veneer is primarily cosmetic.
Okay.
Or a crown, essentially you're taking weakened tooth structure and you're holding it together with a crown. It can be cosmetic and it should be cosmetic, but the purpose of it is different. You're trying to hold the tooth together. You're taking a tooth that's had too much filling material and you're you're successfully holding it together so you can chew on it and chew on it properly without it breaking apart.
Is the preparation for a tooth for a crown much the same as for a filling?
No. For a crown, and we do have a model of what a large-scale model of what a crown is. You do need a full 360-degree preparation of the tooth
For a crown.
for a crown. For a filling, all we're looking for is to remove, if the patient either chipped a tooth, we replace the chip, or if they have decay, we remove the decay and fill in just a portion of the tooth that we lost.
But do you, when a person comes in for a filling, often find that a crown is the more preferred method of treatment than a filling?
There are times, and generally it's when we first get a filling. Generally, if you come see the dentist on a regular basis, we catch the decay when it's small. So we start out with a small filling, and then the filling over time washes away a little bit. The margins aren't as tight to the tooth as before, so we need to redo the filling. So the filling gets a little bigger. We redo the filling, it gets a little bigger, and then at that point, there's not a lot of good tooth structure to hold a filling anymore, and then we opt for something like a crown.
What are the dangers of a person having tooth decay and not having it treated? What can continued failure to treat decay, what can that do to your mouth?
We see that a lot. It's the patient that has the toothache, and they let the toothache go, and it goes longer and longer, and all of a sudden, no more toothache. They think everything's fine. What happened was they destroyed the nerve in the tooth, the nerve died, and now they have a trapped infection below the gum line at the root of the tooth where it's just constantly eating away at that bone. They're not going to feel it, they don't have any discomfort with it, but it's doing damage that they don't know about.
Is it they don't have a feeling because they've destroyed the root?
Destroy the nerve.
The nerve.
And certainly, I mean, one of the things that we've talked about on our radio program and also in my book, or I should say our book, is the fact that these trapped infections, particularly in the back of the mouth here, the teeth are just adjacent to the sinus. And literally, if you let that decay go, the decay will go into the nerve will be filled with bacteria now, and so it won't be a nerve anymore. It's a direct channel into the sinus and can create a hole in the sinus. Study was done in Pittsburgh not too long ago on failed sinus surgery. And what they then did was look back at the CT scans, and instead of looking at the sinus, they went a little bit lower and they looked at the teeth. and they found out that in over 70% of the cases of failed sinus surgery, it was due to abscessed teeth. And that's what caused the failed sinus surgery. Then you treat the tooth, or you extract the tooth, and the sinus repairs itself.
You mentioned your book, The Ultimate Mouth Manual. Did you help your dad with that book?
I did. I was a contributor in the first volume. The second volume's coming out in a couple months, and I've got a larger role in there.
You have a larger input into the second one?
There's a lot more on restorative dentistry in the next volume.
Well, I want to compliment you on the first book. I haven't seen the second one, but I would recommend to you, the viewing audience, that you contact Dr. Sheldon and see about getting a copy of the book. Because what I found very advantageous in the book, your first book, The Ultimate Mouth Manual, was the simplicity of the drawings in there, not meaning that they were done, that they weren't professional. That's not what I meant. What I meant was they were so simple that a person could easily understand what you were talking about what was happening with the tooth and why things needed to be done. The way you explained very complicated parts of dentistry and the effect on the body and other diseases, contributing factors, the way you put it together in that book helped me understand a lot more about how I could do a better job of moderating and writing these shows on dentistry.
Well, thank you, Joe. I appreciate that.
It's true, because information and education, there's no substitute for that. There's nothing that can help a person more than understanding what a problem is that they're developing in their body.
And that was the purpose of that book. And of course, the second book carries more into restorative dentistry, which is, of course, what Matthew does every day. And so now, rather than just the biological and the dental implant part of it, as well as the health articles that we write, now there's a firm basis for all of the restorative techniques, whether it's fillings, whether it's crowns, whether it's how to restore an implant, whether it's partial dentures. All of those are included in this volume, which is a much more well-rounded volume than the first one was.
I suspect this is going to be more of your field, but let's talk about full and partial dentures. When do you decide when a patient needs a full or a partial replacement? How do you decide in the first place, Matt?
A partial denture is replacing the teeth that they're missing, and if it's 1, 2, 3, it doesn't. It's up to a number, and there's got to be, and it's all about diagnosis. We have to see how good the patient's remaining teeth are if they can support something like a partial denture. For example, this is a partial denture where the patient's missing 3 teeth. Assuming that the rest of the teeth around it are healthy, this partial denture is a decent option. There are,
but here, these things right here, those attach to a tooth that's in the mouth.
Correct. So, exactly, there's clasps here that attach to the teeth next door. These teeth around it have to be solid, have to be healthy, or else the whole system's not going to work. So the rest of the teeth in the mouth still have to be solid if we can approach a partial denture. Now, better than a partial denture, we have options of dental implants, fixed bridges, and let me go into what happens if we're missing a single tooth. So a patient, for some reason, lost this tooth in the middle.
Okay.
The old way of doing things, which is still done regularly, is we prepare this tooth for a crown, the tooth next door for a crown, and we cement 3 teeth back together. So we've bridged the gap between the space that they're missing. So that's what a fixed bridge is. Another option is keep these 2 teeth how they were and place a dental implant.
So you're only fooling with one tooth?
So the tooth you're missing is the tooth you're replacing, and you're not cutting down healthy teeth to support. And then we place a single crown on top of that, and then we've got a full set of teeth back in that corner.
How long has this implant thing been around?
Modern era of dental implants began in 1982. Now, dental implants were experimented with for centuries, but in 1982, precision drilling techniques were developed so that the dental implant precisely fit into the socket that we prepared. And that was the difference. And that's what made dental implants the most successful of the tooth restorations and has greater longevity than any of the other things that we do. Partials, bridges, that type of thing. Dental implants is number one.
50 years ago, I was on a submarine, and 2 Navy reservists we had on board saw that I had a tooth problem, and they took me up to the submarine tender on Saturday morning, put a rubber dam in my mouth, started grinding, cutting, and everything else, and they repaired this tooth and this tooth, and there were 2 teeth in the middle. They took them out, put a permanent bridge in, made a gold thing, and they anchored them, and they put a pin down. I thought they put an implant, but you found out, you replaced it here about 1.5 years ago on me. You put implants in.
Yeah, and that's a common misconception. People say, I had a dental implant. No, you had a post placed within your tooth.
In my tooth.
And in this case, in a dental implant, the tooth is coming out and you're placing a post within the bone.
You know what the hardest thing on all that work those 2 guys did on me was?
What?
Keeping my mouth open for 8 hours while I sat there, and they talked and joked and cut and ground and did everything else.
Bet they didn't sing to you, Joe.
Yeah, but what was interesting to me was, when you did the implant on me, you found that my bone had receded.
Right.
You were able to do that process where you take platelets from my blood, and you got a product you mix it with and put it in a centrifuge, and you put that on my jaw. You grew so much bone that you had to surgically extract some of that bone to make enough clearance to put the implants in.
You're a good healer, Joe.
Well, but it shows, Lee and Matt, the advances and what we can do to help people chew better, digest their food, and enjoy their food, which we certainly can't do if our teeth are not right.
That's right. Yeah, and I get, this is a seniors program. And I've got to tell you that one of the common objections that we have is, well, I'm only going to last a few more years, therefore is it worth spending the money on this? And the answer is, as we get older and older, we have fewer and fewer things that we can do. But if we're thinking about our mouths all the time, or if you let things go and now your relatives are visiting you and you can't find your teeth, that's a pretty embarrassing situation. And so on the other side, if people restore their teeth and they're not thinking about their teeth, they're not thinking about their mouths, they can smile, they can eat, they can laugh, and as importantly, they can chew good, nutritious foods and keep themselves going a lot longer and a lot more comfortably.
It's interesting you talk about losing your teeth. My father had full dentures. And one day he said to my mother, he said, Libby, where was that handkerchief that was on my dresser? And she said, I put it in the washing machine, Joe. And my father's response was, forgive me, being I said, hell, Libby, my teeth were in that handkerchief.
Yeah.
She had grabbed my dad's teeth, put them in the washing machine. But with the type of procedure we have available today, we can mitigate and lessen that kind of thing.
And let's take a look at that procedure, because this is a substitute for a full denture. And I'm going to show it to you, and I'm going to move it around, and I'll show you what's been done here. Now, what you're seeing is denture teeth, denture acrylic, but if you look under here, you'll see a nice bar.
Yeah.
Which is attached to dental implants. See these little screw holes here? Seth, are you seeing that? Yeah. So essentially what we've done is replace the full denture with something that's now anchored to dental implants, and the roof of the mouth is free. So your tongue is touching the roof of the mouth again.
I'm feeling it.
And well, you can taste your food again. Because you don't have that situation. People who have full dentures where the palate is totally covered by plastic, if you have a full denture, you know what that's about. Well, This is actually the old way, believe it or not. Here's the new way. And this is an all ceramic solution. So rather than having the metal bar and the denture teeth, robotically, teeth are carved out exactly the way we design them by a machine that can duplicate the teeth the way we want them to be. And then one ceramic piece is carved out by a machine. It takes well over 20 hours for the machine to do that work. And then the laboratory custom stains everything. And now you can have a set of teeth that's also secured by screws. You can't see the screws here, but you can see the final result, where you've got an all ceramic solution that chews and chews well and doesn't wear like denture teeth would wear.
Do you find many people in your practice, Matt, that are not potential clients for this type of work?
One of the common things we hear is the patients were told in the past that they don't have enough bone. We were able to find bone. If the patient's a good candidate, we can make it work.
That's right. I mean, even if with a CT scan, that's important. The CT scan is really, really important when we're doing this diagnosis because we need a certain volume of bone in order to be able to do the work that we do. In other words, if a dental implant has a certain volume, you need more bone in order to be able to support that dental implant. Well, traditional x-rays won't show how much bone there really is. Traditional x-rays are only looking at you two-dimensionally. We need a three-dimensional view.
But you have that capability in your office?
Oh, sure. And many offices do.
Many offices do?
Yeah, many of the specialty offices do. CT scans are available. As a matter of fact, for those who aren't seeing us, when this is necessarily to tout us, there are actually mobile vans that come to dental offices with three-dimensional CT scan capability where you get in the truck and you have the CT scan taken so that your dentist can identify how much bone there is. And it's extremely important that you have a CT scan taken to determine whether you have enough bone or not.
Yeah, we've tried to make some light moments in the different TV shows that we've done, but dentistry and the reasons for a solid practice of good dentistry are extremely important. So we got 28 seconds. What would you say to our viewers about what we're talking about? What should they do?
Main thing is go to a dentist. Find someone you trust. Find someone you like. If you need a second opinion, third opinion, go to someone that's got a working relationship with you and develops a treatment plan that you're comfortable with and get the work done that you've been putting off for some time.
Okay. Thank you, Lee. Thank you, Matt.
Thank you.
Thank you for doing it.
Thank you, Joe.
And I want to thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call us at 321-473-770. For more information on senior care and resources, visit our website at helpingseniorsofbrevard.com. Be sure to listen to Focus on Seniors on radio station WMEL AM 1300 every Thursday morning at 9 a.m. and look for us in your Florida Today Health section for our Focus on Seniors column. I'm Joe Steckler, and thank you for joining us today for Focus on Seniors.